as the World Immunization Week is celebrated in the last week of April, which was aimed to highlight the collective action needed to promote the use of vaccines to protect people of all ages against diseases. The Executive Director of Kwara State Primary Healthcare Development Agency, Dr. Nasirat Elelu, has urged parents and guardians to avail their children the opportunities to get vaccinated. She made the admonitions during a press conference held in Ilorin to commemorate World Immunization Week. Dr. Nasirat maintained that immunization is one of the most successful and cost-effective health interventions, which have been preventing between 23 million deaths every year and have reduced morbidity and mortality across the world. Speaking further, she noted that the benefits of immunization are increasingly being extended to adolescents and adults, protecting against life-threatening diseases such as influenza, meningitis, and cancers that occurs in adulthood. Dr. Nasirat said that the Kwara State Governor Abdurrahman Abdulrazak has demonstrated his belief in immunization program by constituting a functional task force on immunization and primary health care under the chairmanship of the Deputy Governor Kayode Alabi. Added that the governor has provided an enabling environment by making funds available for the implementation of immunization campaigns.
So I'm also going to go through what the state is doing, especially in terms of providing high quality immunization coverage for eligible population in the state. So Kwara State government, under the leadership of His Excellency Malan Abdurrahman Abdulrazak, has demonstrated his belief in immunization. You can see him physically attending our flag off programs, physically even coordinating some of our vaccination activities. So we could see his commitment to immunization and even prompt provision of counterpart for both routine and of course supplemental immunization activity. We also have a very functional state task force on immunization, which is chaired by His Excellency the Deputy Governor of Kwara State, and not just state task force on immunization, but of course on PHC services, which we meet quarterly to provide update, and of course he provides a lot of oversight to ensure that we have quality delivery of immunization services in the state. Similarly, His Excellency has also provided an enabling environment for immunization and immunization activity by making funds available, like I said, as counterpart for not just our routine but of course supplemental immunization activity. So in the last 1 year, the Kwara State Primary Healthcare Development Agency, with the support of the State Task Force Immunization as well as His Excellency the Governor of Kwara State, have been able to deliver over 600,000 doses of people that have been vaccinated for COVID-19 vaccination. So what I'm saying is that as at now, over 600,000 people in Kwara State have received at least one dose of COVID-19 vaccination. We have also been able to provide, to deliver oral polio vaccine for 1,280,000 children for oral polio vaccine, and that is why with our sustained coverage we have little or no minimal outbreak of polio in the state. We have also been able to reach 593,000 children for measles vaccine in the last year. So this, we are not relenting as we continue to also engage and of course deliver life-saving vaccines to people of eligible ages in Kwara State. For this year in 2022, we have also had two polio campaign to reach over 1 million people in each of the two campaigns, so that we can continue to make sure that the level of immunity of the children in Kwara State is sustained towards that throughout the period. I would also like to add that now that we now have at least one functional PHC in each of our geopolitical wards, I would like to urge every one of us that the PHC of today is not the PHC of yesterday. There's needs, we had an assessment of people to find out the reasons why they have not been accessing our PHCs, and we found out that one of their reasons is the lack of confidence in the quality of care. I would like to categorically and emphatically state that the PHCs that of today now have quality. At least in the last 2 years or more, we've had quality of service improve significantly. Of course, this is a work in progress, and it is not like we're there, but we're on our way to ensure that at least we have one ward that has a functional PHC to provide all these services for